story, and then it depends on which option they choose. Then they go through this whole story, and also real-time data capturing accelerated by 5G. This is actually an example of a hospital in France, the University Hospital in Nantes, that used our technology for this operation. It's very short, just an example. That has used our technology, so the WebXR API, to distribute this content to their medical staff because it was an educational experience. It was a special operation, and they wanted to show which devices they used, how it worked, etc., etc. Thank you very much for your attention. And if you have any questions.
Thank you, Flore. So the last company to pitch is Noya, and the person here to pitch is Ufuk Aydinli.
Well, good evening. Closer. Well, good evening. It's very exciting for me to be here, and I'm really delighted to listen to surgeons. I'm also a surgeon. I'm an orthopedic spine surgeon, and I'm working in this business last 27 years. I also teach because I was at the university as a professor of orthopedics, and I also involved with the non-profit organization of the international organization, and I was the board member of this organization. I'm the trustee right now in this organization, so my whole life is between teaching and doing surgery and treating the patients. Learning a new procedure and executing it with success mainly depends on how often you repeat it. However, while pilots get to practice in simulators flying numerous times before they are actually trusted with a plane, physicians did not have such a luxury until recently. I learned my job through a long and sometimes tortuous process of master-apprentice relation. If you are a surgeon, you can understand that what happens between the residents and the boss and the relations between the residents. So you have to suffer a lot during this process. In a very large number of places, young surgeons graduate without having the chance to perform a significant number of procedures, and the result depends on their photographic or videographic memories. So we know that as a surgeon and a teacher that most of the time the residents will graduate without doing the procedures in enough number. The approach to surgeon training is the same today in all over the world. The master Jedi gathers his young Padawans around him and show how to use a lightsaber. Today, there is no standardization in spine surgery training around the world that can only be achieved with repeatable and easy to access simulator, which helps you to do everything the same way every time you do it, wherever you are doing it. Even worse, 80% of learnings in training is forgotten in 3 years. 3 days, sorry. The repetition of the procedure is not easy, and practice is problematic due to the possible patient dissatisfaction. A simulator is a perfect remedy to this universal problem. 3 years ago, we from different backgrounds started an ambitious project. We created a simulator and named it Sharp Surgeon. It is a virtual reality surgical training platform designed for surgeons. We have developed an immersive VR experience using our software that can train surgeons to perform spine surgery procedures. We offer highly realistic hand-based interactions in a training environment that reflect the modern operation rooms. Sharp Surgeon is one of the most progressive virtual reality operation rooms in today's world. Sharp Surgeon is not only a passive surgical VR program, it teaches the beginners how to do and how not to do the surgical operations. You can practice something repeatedly and not on a patient which is brand new for the most part in the field of the medicine. A private research already demonstrated that VR training surgeons perform 2 times better than their peers in real surgery. Let me show you a sneak preview of our project. This is our team. Can we have the, okay. As you can see, the surgeon is working here, and this is the real environment. We have the whole operation room, 360 degree with C-arm and everything in hands, and surgical tool. And the surgeon grabs this right surgical tool to make the necessary procedures. If they make something wrong, they will see in this screen that they are doing a right thing or a wrong thing, and even they can look at the on a C-arm how the screw is going on, where it's going on. They can look at the angles, sagittal angles, coronal angles, to make a right entry for the pedicle screws. As the spine surgeons know that in different areas of the spine, for example, upper thoracic area is much more different than the lower lumbar area. So they have to know that which degree they are gonna make the right pathway for the screw. And all of these things will be shown on the screen, and you will see on the screen that the screw is in right position or it's in a wrong position. So with step by step, they will do the surgery till to the end of the procedure. So today, you can take a look at the ultimate tool which will make self-confident and proficient surgeons and happier patient possible. Thank you.
And here is your last GT1. Thank you. Okay, so thank you, Ufuk. This is now the time for questions. So if you have some questions for our entrepreneurs, please do. If you don't, it's still okay. You can have this conversation during. Do you have a question, Jenny? Okay. Yeah. You are.
I have a question for Everest. I don't know where he is. Okay. So I think the VR arcade is very interesting. Are you working on any 360 treadmills in order to simulate the movement or keep persons in the center?
That's an interesting question indeed. So these are possibilities. We don't have it yet in the arcade. So we are working with Rehabilitation Center to see if that's something that can work. So for example, there's also the rehabilitation, not the centers, but the ones that actually provide the tools to do the rehabilitation, like the treadmills, that are interested to also see if this would actually augment their device, because these days they basically use a flat screen, which is not ideally, but also just to how you put your feet is exceedingly important. So basically, if you have left brain hemorrhage, then basically your foot will kind of slope, and that's something that can be in virtual reality. You can put your foot correctly, and that way force your brain sort of to reprogram itself and then put the foot correctly. And that's something that can be done in these games, and that's why virtual reality is definitely interesting in combination with the treadmill. But the problem with the treadmill is there's always somebody that needs to be next to it, because the person doesn't see the environment. So it's kind of, it's more dangerous than a normal thing.
I wasn't talking about the rehabilitation, but for gaming purposes. because the problem is that especially when you're tethered, like with the HTC Vive, you can't move. You have this translation tracking, but you can't move in any direction. So if you have a treadmill, like in Ready Player One, and I've seen YouTube vid on that moves in any direction, so it gives the opposite movement. And
So there's these technologies exist also. So that's basically an omnidirectional treadmill. But the problem there is that you have a lot of motion sickness that happens. So people are moving, they're basically sliding over some kind of weird carpet with some special shoes that are non-resistant basically. But often people have motion sickness with these type of type of devices. They are improving, and we are hoping and we are working together with some of these companies to see what actually works and what doesn't work. But we don't have them yet in our arcade just because of that reason. We don't want to have people make sick. So.
Thank you. Presentation was great. My question is actually for Julien for on comfort. So how are you objectively measuring anxiety, for example, or even pain? You know, it's very subjective measurements, and they usually happens after the fact. You know, for pain or anxiety, or patient doesn't really remember. They kind of guess more or less the number, and there are other scales, and there are proven scales in psychology, and but now there are tools that might be able to check physiologic variance on skin intelligence and whatnot. You're probably an expert on it, but I just found out today. I was in where was I today? In Antwerp. In Antwerp at this, and one of the companies from Belgium, they are actually Impulse is the name of the group within this ProFact group, and they are measuring with electrodes in the skin the actual numbers on anxiety and stress levels when people is in VR, so they can quantify how. And the other thing is in anesthesia, you know, and I was talking to my friend Arnaud here, anesthesiologist. You know, we use in the ICU-based monitors also. So have you tried using that to quantify better or more accurately, maybe?
Thank you for your question. Actually, most of the time we use traditional scales, so numerical analogical scale, or NAS or VAS. But for example, in one of our study in we have anesthesists using what they call a pain matcher. So basically, it's electric signal which is stronger and stronger, and the objective is to see what's the resistance of the patient from this electrical signal, to see if they can have like tolerate higher level of pain. And that's what they observe also, is that with our solution they can have a very higher level of pain which is tolerable for the patients. But at the moment it's more subjective analogical scales that we used to measure that.
I have maybe a controversial question, sorry for this in advance, but what you describe as your solution is actually a VR experience for the patient. So what differentiates the uncomfort, which is actually an experience, from other readily available experiences, sometimes for free, from the Oculus store, for example?
Thank you. That's a good question, and also a very important question for us, because that's something we try to explain also a lot of time to people. When we developed a module, it goes through a very strict production process. It's a very long process with people, with doctors, which are validating all the modules. So, for example, you cannot see it here, but in the VR experience, you have all an hypnotical script from a psychologist. This one has been validated by anesthesiologists from major academic centers. We do tests on patients. We created an alpha version that is then tested on a lot of patients and doctors. We gather all the feedbacks and created a beta version. And then we do a clinical study for that to measure the impact of our VR module. So I can turn the question on the other side. How can a basic VR app can be as powerful as our solution? They should prove it compared to our solution. And that's what we try to show also in our studies. Yeah. Yeah. suggestions. Yeah. It's very specific. Our modules are developed in a wide range of languages. So we have currently 7 languages. We are in the mother tongue of the patient, and every script is validated, goes through a very strict process, and this is a lot of work to get the module done. So yeah. Yes.
Maybe everyone can hear me. Thank you for the presentation. Do you have any feedback on the hypnotic procedure, you say? Because hypnose combined with VR can also trigger something else. So after the surgery, okay, you can measure pain, anxiety, and all these type of things. But do you see the patient afterwards to see how the hypnotic process might trigger something else to the patient?
Yes, of course. All the demos we've been doing on patients, we always ask feedback from patients before the experience, but also afterwards. And what we see, of course, is that hypnosis, it's not having the same impact on everybody. So people are reacting differently. To give you some very practical example, we have people who fell asleep on the operating room during an orthopedic surgery, which is not an easy type of surgery and a quiet surgery. But we have other people who are just feeling more relaxed, and it's less powerful than for people who fell asleep, for example. So, but every time we ask questions to the patients after the experience, we always have more or less positive feedback coming from us. Yeah. That's true. That's true. But we have patients coming to us after a few weeks after the surgery. But it's true that we are not asking them questions even 1 month or 2 months afterwards. It's true.
Thank you for this nice evening. I'm working as an anesthesiologist in pain medicine, and I'm just using VR. From sometimes I met it a few years ago when it was just the beginning of it, and I was always surprised by the experience, because it's very nice, very new. It's with a lot of hope of doing something more than just medication with the patient. I just want to know to all those persons who were experienced tonight, if there is no VR experience where you just integrate some of the physiological parameters of the patient, for example, cardiac variability or stress measurement in the VR, and modification of the VR environment by those physiological aspects of the patient. So till as the patient has the opportunity to change the world where he is by his own feelings, and I think that's very important in VR.
Actually, regarding the technology of VR itself, not in healthcare because it's not my study, but there are some experiences in film where the spectator can move the story just by where he looks or what he feels. And there's some experiments that are done now and some films that are developed in that way, actually. But I don't know what's happening in healthcare regarding that. So that's my 2 cents.
I'll let you go floor afterwards. If I say something about this, that's also something we are working on. Currently, what you can find, it's people trying to measure the breath of patients and trying to interact with the breath on the environment, but it's still very experimental. I'm not sure of the word. Experimental, sorry. So there is a lot of work to be done there, I think, but definitely where VR in the healthcare sector is going, so it will be the future soon.
Yeah, and just picking up in that sense, it's experimental, definitely. There's some work going on not only in Belgium with IMEC, for example, but also abroad. You have EEG that's implanted in VR. You have also the sense of touch that's basically transported into VR. So basically you can touch something, but these sensors can also be used to input something with, for example, anxiety levels, to measure that and then basically change the environment. So these are tests. A lot of these things are still bulky, are still expensive, but it becomes much more cheaper and cheaper every year. For example, EEG, you can basically build yourself with a 3D printer and €2,000, and you have your EEG scanner that you can implant in a VR environment. So it becomes possible also for small startups, also for healthcare professionals to actually start experimenting with this in a sprint way and then go to an actual product. So
we're running a little bit out of time, so we can close it here. We can pursue the discussion after. There's still some room and space to do some discussions. To end it, I would like to thank you all. Thank you, the audience, for attending the event. Thank you, the speakers, of course, for attending and presenting some very interesting thoughts. And I would like to thank my colleague Christophe. And also, last but not least, I would like to thank Digitizer and Tanguy especially. And Tanguy will do a little explanation about what they do in Digitizer and what's coming up next.
Merci, thank you. Just to finish with, there is a Fitbit as well, where they collect all your data, and there is like an SDK, and you can put it straight within your experience. And it's quite fun, actually. From a gaming perspective, it's nice. Just very quickly, thank you for being here. Thank you very much, Marine. Thank you very much, Christophe, for supporting us, Digitizer. So we are mainly on a few verticals. We are tech hub. This is a place where lots of events, many events happen. It's been a year that we've been alive, and since then, we hosted more than 200 events, like this one, smaller ones, like just on the third floor. Heard some people laughing. Actually, it's a meetup about R in ladies, ladies who are coding R. They're just 20 and just crazy and doing a lot of stuff. Lots of coding, lots of trainings. You have the possibility to come and work here for free from 9 to 5 here on the ground floor. There are possibilities to rent a space, a pod upstairs. It's quite cheap. It's €150 per month without tax, everything included. But the most important thing is about VR. Be lots of trainings that are being supported by the Brussels region, and we have quite a few boot camps coming over about Unity, about web VR, about anything you'd like. So come and talk to if you are interested for these trainings and boot camps. And we're very happy as well to have this partnership with LifeTech. I mean, partnership by coming over here. And this is great. Thank you very much. Enjoy.